Imagine you've built a powerful race car, but before taking it to the track, you need to make sure it performs at its best. You don't just assume it's fast, you test it under different conditions, measure its speed, check how it handles curves, and fine-tune its settings. This is exactly what happens in machine learning when evaluating a linear support vector classifier, SVC. You can't just train a model and assume it works. You need to measure its performance using well-defined metrics to ensure it generalizes well to unseen data. One of the most fundamental ways to evaluate linear SVC is through cross-validation. Instead of training the model on one fixed dataset split, cross-validation divides the data into multiple training and testing sets, ensuring that the model is assessed on different subsets of the data. This helps prevent misleading results caused by a lucky or unlucky data split. Cross-validation is like testing a car on multiple racetracks instead of just one, making sure it performs well across various conditions. Key performance metrics help determine whether the model is making accurate predictions or if it needs further tuning. The most commonly used metric is accuracy, which measures the proportion of correctly classified instances. However, accuracy alone can be misleading, especially when dealing with imbalanced datasets where one class dominates the other. To dig deeper, we look at precision and recall. Precision focuses on how many of the predicted positive cases are actually correct, critical in situations like spam detection, where false positives can be frustrating. Recall, on the other hand, measures how well the model identifies all actual positive instances, which is crucial in medical diagnoses where missing a disease case could have serious consequences. When precision and recall need to be balanced, we use the F1 score, which calculates their harmonic mean. The F1 score is particularly useful when working with imbalanced datasets, ensuring that neither false positives nor false negatives are ignored. Beyond these metrics, another important tool is the confusion matrix. This table shows the breakdown of true positives, true negatives, and false negatives, providing an intuitive way to see where the model is making errors. If too many false positives or false negatives appear, adjustments may be needed, but raw numbers alone aren't enough. We also need to ensure that the model isn't overfitting or underfitting. Overfitting happens when the model memorizes the training data too well, but fails on new, unseen data. Underfitting, on the other hand, occurs when the model is too simple and fails to capture important patterns in the data. Cross-validation, regularization, and feature selection help maintain a balance, ensuring that the model generalizes well without being too rigid or too loose. Evaluating linear SVC is more than just computing a few numbers. It's about understanding how well the model generalizes, where it struggles, and how to improve it. But what if things don't go as planned? What are the common pitfalls that can lead to misleading results or poor model performance? That's exactly what we'll explore next. Imagine you're building a sturdy bridge, confident in its design, only to realize later that strong winds and unexpected traffic loads cause cracks to appear. In machine learning, relying on linear SVC without accounting for its weaknesses can lead to similar cracks in performance. While linear SVC is a powerful and efficient classifier, there are several common pitfalls that can lead to poor results if not handled correctly. One of the biggest mistakes is ignoring feature scaling. Linear SVC is highly sensitive to the scale of input features, meaning that if one feature has values in the thousands and another ranges from 0 to 1, the algorithm will give disproportionate weight to the larger scale feature. This skews the decision boundary and leads to biased classifications. To avoid this, it's crucial to normalize or standardize all features before feeding them into the model, ensuring they have comparable scales. Another major pitfall is not addressing outliers. Linear SVC determines the decision boundary based on the support vectors, the data points closest to the boundary. If even a single outlier falls far from the main cluster, it can pull the decision boundary towards it, leading to misclassifications and reduced generalization. Robust pre-processing techniques like outlier detection and removal can prevent this from happening. Then comes the problem of overfitting versus underfitting. Linear SVC works best on data that is actually linearly separable. If the dataset is too small or noisy, the model may memorize the training data instead of learning general patterns, leading to overfitting. On the flip side, if the data is highly complex and nonlinearly distributed, forcing a linear model will cause underfitting, meaning the classifier fails to capture the full structure of the data. Cross-validation and proper regularization can help balance this trade-off. Another common issue is blindly setting the regularization parameter C without tuning it. A high C value tries to fit the training data perfectly, often at the cost of generalization, while a low C value results in a larger margin but allows more misclassifications. Without careful tuning, using methods like grid search or random search, the model might perform well on training data but fail miserably on unseen data. Lastly, not performing proper feature selection can lead to unnecessary complexity. Including irrelevant or redundant features increases computational cost and introduces noise, making the classifier's decision boundary less reliable. Feature selection techniques such as principal component analysis, PCA, or recursive feature elimination can significantly improve the model's performance by retaining only the most informative features. Linear SVC is a powerful tool, but it must be used correctly. Avoiding these common pitfalls, scaling issues, sensitivity to outliers, overfitting, poor regularization tuning, and irrelevant features ensures that the model delivers reliable and accurate results. But once you've successfully built an optimized linear SVC model, how does it perform in real-world applications? That's exactly what we'll explore next. Imagine a doctor trying to diagnose a disease based on a patient's symptoms and medical history. Every second counts, and a wrong decision could mean a misdiagnosis. Traditionally, doctors rely on years of experience and intuition, but what if machine learning could enhance their decision-making? This is exactly where linear SVC is making an impact in the healthcare industry. In this case study, linear SVC was employed to predict early-stage diabetes based on a dataset containing 10,000 patient records. These records included critical health indicators such as age, BMI, glucose levels, blood pressure, and family medical history. The challenge? Identifying patterns that indicate a higher risk of diabetes, patterns that might be subtle, non-obvious, or easily overlooked in traditional diagnosis methods. By training the linear SVC model on historical patient data, the algorithm learned how healthy and diabetic patients differed across these features. Once trained, the model was tested on a separate set of patient records, achieving an accuracy rate exceeding 85%. More importantly, the model identified at-risk individuals before they exhibited severe symptoms, giving doctors a chance to intervene early with lifestyle recommendations and preventive treatments. But the impact didn't stop there. The hospital integrated the linear SVC model into their electronic health record system, allowing doctors to receive real-time predictions as they entered patient data. Instead of spending hours analyzing risk factors manually, the AI provided instant assessments, helping physicians make faster data-driven decisions. Despite these advantages, there were some challenges. The model struggled with cases where patients exhibited borderline symptoms. And because linear SVC assumes a linear relationship, some complex medical conditions required additional feature engineering. To improve its performance, the hospital experimented with feature selection techniques and hyperparameter tuning, ultimately achieving even higher accuracy and recall rates. This case study highlights how linear SVC is revolutionizing healthcare by enhancing early disease detection, reducing diagnostic errors, and improving patient outcomes. But this is just one industry. Linear SVC is also transforming finance, marketing, and beyond.